Joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, more than 500,000 Americans have been vaccinated so far. First, the Pfizer vaccine, Moderna rolling out its vaccine now. Where are we in the fight to get this thing under control in our country?
Good morning, Craig. You know, it's still going to be an uphill climb, as all forecasts are suggesting, especially the one from the University of Washington. We are expecting that vaccination is really not going to impact the course of this pandemic until the early spring, so March, April timeframe. We think around that time we'll probably have averted, hopefully at least, about 40,000 deaths here in this country. But that just raises the specter of how important it is to continue to avoid non-essential travel, to continue to mask, distance, all the infection control measures that really matter at this point of the year.
Dr. Gupta, there appears to be some indication that this Moderna vaccine especially could actually eliminate transmission. How significant would that be, and how long will it take for us to know whether that's actually the case?
You know, both companies, Pfizer and Moderna, are actively developing a data set to answer that question. Moderna, as you just suggested, in the data they have presented some early data suggesting that transmission, in addition to severe infection, are both averted with their vaccine. We're going to have some greater clarity on this in the next 4 weeks. Again, both companies, in addition to the companies with candidate vaccines in the pipeline, are trying to answer this question more rigorously with more data points. If this is true, Craig, then I think this is important because there's a sense out there, I've heard from some Americans, that, you know, once I get the vaccine, I'm going back to normal life. We are begging people not to do that. But if we can get some clarity on this issue, it will allow some degree of normalcy, perhaps a little bit more quickly, for those who've gotten vaccinated. But again, open question. We still need people to keep their guard up.
Dr. Gupta, you were one of the first folks vaccinated last week there in Seattle. In fact, you did it right here live on the Today Show. At this point, any lingering side effects? As you know, there are still a lot of people watching and listening that are very reluctant about the idea of getting a vaccine shot in their arm that was developed in less than a year.
Not at all, Craig. 24 hours after I got the vaccine on air with you, I had a little left arm soreness that pretty much resolved within that 24-hour time period. Didn't have a fever, didn't have a headache. Really looking forward to getting that second dose on January 6th, and I appreciate the platform to do it on air.
Really quickly here before I let you go, news out of Great Britain this morning, out of the UK, that there's a mutation apparently that they have discovered that could be 70% more transmissible. What more do we know about that? How concerned are you about it?
No, honestly, Craig, we don't know a lot about that number, that 70% number. It's based on studies that have been done in the lab, not actually really analyzing data amongst humans. And there's some suggestion here that really it's human behavior that's accounting for this increased spread in Britain and in South Africa, less that strain of the virus. So more to be determined on that specific issue. Let me also just quickly say that the vaccine, I've gotten this question a lot in the last 24 hours as well, the vaccine will be effective against this new strain. It takes years before, say, the influenza virus is no longer responsive to a vaccine in any given year. It takes years for that process to occur. It's going to take years for that process to occur for COVID-19. Sometime down the road, we may need to update the COVID-19 vaccine if we do need to take it over the course of years, but certainly not now. This vaccine will be effective against this strain, rest assured.
All right, good to hear. Dr. Vin Gupta for us this morning. Dr. Gupta, thanks as always.